Good morning. My name is Peter Pepalugiski, and I'll be discussing my literature review regarding the visualization in endodontics. Endodontics is a specialization in dentistry focused on dental pulp, the tooth root, and the surrounding tissue. They commonly treat cracked and decaying teeth and dental trauma, but primarily deal with root canal therapy, commonly abbreviated RCT. This area has been riddled with musculoskeletal disorders and has greatly benefited from advances over the past 15 years. New technologies and optical aids have caused improvements in ergonomic concerns as well as surgical precision. As previously mentioned, root canal therapy is a common procedure for endodontists. By discussing the optical tools for the root canal therapy, it will serve as an overview of the ergonomic gaps and solutions for endodontists due to its high prevalence. When there's a threatened tooth in need of RCT, inflammation or infection may already be present. The first step is to drill into the pulp chamber of the tooth and remove the infected region. Next, the root canal's nerve is removed by drilling, and then the tooth is filled using an inert material such as gutta percha. Finally, the endodontist seals the tooth and with the removal of the nerve and blood supply fits a crown. As you can see, there's a diagram detailing the steps on the bottom of the slide. Due to advances in visual aids, root canals have gone from being a 3-day procedure to a 1-day, 1 to 2 hour visit. This can be attributed primarily to tools that allow magnification 4 to 25 times the human eye. This has resulted in increased speed and efficiency of the endodontist in respect to more precise motions with less errors. In addition, the patient benefits from a reduction in pain. Prior to optical aid advances, endodontists relied primarily on their eyes during surgery. Notable gaps were inefficiency in handling the instruments due to excessive motions and using tools for unintended purposes. Furthermore, high muscle tension and physical load was a result of having to use the tools in awkward positions for prolonged periods of time. Ultimately, these gaps are a result of the overarching poor visualization of the surgical area. The solution to these gaps came in the form of advances in magnification and visual technologies over the past 15 years. Primarily loops, as seen in the figure to the right, and operating microscopes. These two tools address technical issues as well as ergonomic ones, resulting in their quick adoption. Musculoskeletal disorders, commonly known as MSDs, are alarmingly prevalent in this field, with 65% of international endodontists reporting pain primarily in the back and neck areas. The risk factors for this pain are from static and awkward positions such as slouching and craning one's neck. As you can see in the picture, the spine is in an extremely strenuous position that puts heavy loads that could lead to serious complications after prolonged periods. Loops are devices attached to the glasses that increase magnification of the surgical area that have resulted in the benefits of increased speed, accuracy, and efficiency. However, they did little to alleviate MSD concerns. Some fatigue issues were resolved, such as reduction in hand movements from being more precise and a reduction in time in awkward positions. Research, Recent research has shown that sitting upright helped reduce MSD complaints within a 4-week period. But as seen on the previous slide, keeping the back straight in surgery would be difficult. A bigger advancement came in the form of the operating microscope. As demonstrated in the image, the spine is kept in the proper position and there is correct back posture. The awkward arm motion of resting the arm on the leg was reduced, as seen on the previous slide, and concerns about depth perception are mediated by tactile feedback so that accuracy is not compromised. This instrument addressed one of the two primary areas of MSD complaints. While loops were a good intermediate solution for the aforementioned gaps, the operating microscope stands out as a much better tool. As mentioned previously, operating microscopes address back concerns, but more recent ones also feature adjustable scopes that minimize neck extension and flexure. As seen to the right, the neck has a wide range of motion and therefore can be easily fatigued. Craning the neck or staying in an awkward position for extended periods of time are one of the major MSD complaints. Thus, allowing flexibility in deciding how close or far to place the operating microscope greatly mitigates these ergonomic concerns, assuming that one uses them properly. Based on my literature review, there are many operating microscopes on the market. An example of such a scope is the Carl Zeiss brand. As detailed in the previous two slides, it would address the ergonomic concerns of the back and neck. The ability to adjust the scope, as seen in the picture, essentially widens the field of view and reduces the need to move the neck side to side or crane it or awkwardly position it. By addressing the major MSD complaints as well as providing technical needs to appropriately visualize the surgical area, operating microscopes such as the Carl Zeiss brand appear to be better solutions over previous tools such as loupes. These are the works cited page that I used for my presentation as well as some of them from my report. Thank you for your time today. I can field any questions at this time.